So those who have joined. So am I audible? Is the screen clear so that we can start the session? Okay. So today's topic is, so what I'm starting is targeting the FMG examination 2021 session. So we will solve the anatomy MCQs and we will target the examination of FMG December session. So all the best those who have joined, and let me give you a brief introduction. Meanwhile, the students will join. In the continuation now, I'm going to all the important MCQs related to the topic of anatomy. So we will cover up all the important anatomy MCQs targeted for FMG 2021 examination. So let's crack it together. So myself, Dr. Monalisa, and I have MD Anatomy from Armed Force Medical College, Pune. This is my unlock code ANAT10, which can be used by you if you want to attend the free sessions on the Unacademy platform. So my dear aspirants, just note down, this is my code and unlock and be the part of free session. Also, if you want to take the plus subscription, you can use this code for 10% discount. Now, what are the features of special classes? The special class features are highly beneficial for you because it's an interactive session. As you can see, for now, we can interact among ourselves. Polls are conducted among the learners. So today also, I am going to take 2 sessions of FMG, 2 sessions, okay? And tomorrow, 1. So in this way, we will cover up the entire anatomy MCQs before your examination. So before your examination, we are going to cover up all the important anatomy MCQs, and the revision of anatomy MCQs required is very important if you apply for an examination before that. So you can ask the doubts during the session. Never miss a session. For example, if you start seeing the session, if you start following me, you will get the update of all my notification of all my free and also plus session. After completing the session, you can also download the PDF notes of the session which has been taken. Anytime, anywhere, read from the top educators of Unacademy platform. This is the code, and ANAT10 is the code which can be used by you for getting 10% discount. Now, my dear friends, I want to tell you about the plus course. What are the benefits of plus course? Assess live and recorded version. Learn from India's top educators from the medical team. Compete in live tests and quizzes. Then study on the device of your choice. Access QBank 25,000 plus questions. And coming soon is the printed notes will be provided to you with 12 months and above subscription. So these are the benefits. So use this code ANAT10 and get 10% discount and take the benefit of plus subscription. All the 19 subjects being completed in a very systematic way. So that is the positive point. So do target this plus subscription. My dear aspirants, I would also like to tell you about the iconic subscription where the benefits of plus course and the prep ladder is added on. So already discussed about the plus course benefit. Along with it, you get benefits of clinical integrated sessions of prep ladder, video lectures from the dream team of prep ladder. QBank 3 can be assessed with active guidance system, tax notes, rapid revision, treasure dream notes of 2021. So these are the benefits which will be acquired by you. And I would suggest, if you are going to target next examination, INICT, NEET PG, or next examination or FMG, just go for iconic subscription where you get the benefits of 2 best platform. So go for it. Now, I also want to give you information regarding highly updated effective QBank on the plus of Unacademy 25,000 high-yield clinical MCQs from all 19 subjects. These are based on the latest pattern examination. Detailed explanation is given for each and every MCQs. So just grab the opportunity, use the code ANAT10 and get 10% discount. So I would also like to congratulate the toppers of NEET PG 2021 examination. I'm very glad to share their images with you. Now, about NEET PG subscription, I want to show you this this PPT where the comparison has been done from Iconic and Plus. The comparison of Iconic and Plus has been done. And you can see the discounted rate is there. And you can use the code of ANAT10 for additional 10% discount. And you can go for either 4 years, 3 years, or 1 or 2 years of subscription of Unacademy. So let's start. So today in this session, what I told you, 20 MCQs. And thereafter, again, I will give you a break of half an hour and from 7:30 to 8:30. So today is 2 sessions. One is at 6 p.m. Other is 7:30 to 8:30 p.m. So do join, be present live, and let's solve the MCQ together. All the best, those who have joined. All the best. So can we start the session now? Am I audible? Those who have joined, let's start the session. All the best to everyone. So which of the following structure is not included at the transpyloric plate? The first vertebra, the fundus of gallbladder, the hilum of the right kidney, or the inferior mesenteric vein? So yes, your time starts now, and let's mark the correct answer. All the best to everyone. Okay, so yes, many students has given, so inferior mesenteric vein, absolutely right. Actually, inferior mesenteric artery vessels are corresponding to the lumbar vertebra L3, and it is not corresponding to the transpyloric plane. Okay, all the structures which has been mentioned here are lying at the level of transpyloric plane. So my dear aspirants, I would like to give you the detail. Actually, what I have seen in the trend in the MCQs, that structures lying at the level of transpyloric plane is very important. So what is important for you is that you should revise all the structures which is located at the transpyloric plane. The first point is that what is transpyloric plane? Transpyloric plane is also called as adhescence plane. It is also called as adhescence plane, and it's an imaginary plane located midway between the jugular notch and superior border of symphysis pubis, which is a secondary cartilaginous joint, and the level to which the transpyloric plane is corresponding is the level of first lumbar vertebra. What is its level? Its level is first lumbar vertebra. The structures corresponding at this level is pylorus of the stomach, D1 part of the duodenojejunal flexure, root of transverse mesocolon, hepatic flexors of colon, splenic flexors of colon, fundus of gallbladder, and neck of pancreas. Not only this, we have got a long list. So what I want all the aspirants, whether you are for the NEET PG, whether you are aspiring the NEET PG exam, whether FMG or INICT, what is very, very important is that you should revise all the structures located at the transpyloric plane, which is located at the level of L1 lumbar vertebra. So these are the list of structures. And other than that, also the hilum of both the spleen and kidneys, ninth costal cartilage, termination of the spinal cord, and superior portion of the conus medullaris is also corresponding to this level. The origin of superior mesenteric artery. Please note down, superior mesenteric artery is the level L1, inferior mesenteric artery is at the level of L3. And splenic vein is also joining with the superior mesenteric vein to form portal vein, the cisterna chyli. So all of you can note down all these structures which I have mentioned are the structures which is located at the level of L1 lumbar vertebra. I have included the written detailed part of the notes. What you can do after completion of the session, download the PDF, review the structures so that you can save your time. We will quickly solve all the 20 MCQs, and wherever the important notes and information has to be shared so that you can target a better rank in your exam. So all of you, please revise all the structures located at the transpyloric plane. Let's go. Let's all the best. Let's move on to the second MCQ of today's session. Rectus abdominis muscle is inserted on. So what is the level where the rectus abdominis muscle is inserting? Whether it is xiphoid process, whether it is median plane, whether it is linea alba, whether it is lower ribs. So we have got 4 options, and you have to mark the correct answer. 15 seconds, just 15 seconds will be provided to you, and you have to give me the right answer. All the best. So those who have joined, participate in the poll, because I think few students do not participate. So whether it is right or wrong, participate and mark the correct answer. Okay, so yes, few students has given the right answer, and the right answer is xiphoid process. So rectus abdominis muscle. So can anybody tell me rectus abdominis muscle? When we are talking about rectus abdominis muscle, can you tell me morphologically it is an example of which type of muscle fibers? Morphologically, rectus abdominis muscle is an example of which type of morphological fibers? Anyone? They can write in the message. They can write the answer. Rectus abdominis is morphologically parallel muscle fibers with tendinous intersection. So this is a vertical muscle of the anterior abdominal wall, and it is inserting into xiphoid process. I would like to share a diagram with you where you can appreciate the origin and insertion of rectus abdominis muscle. Let's see it. So rectus abdominis muscle, if I talk about the origin, it is originating from the pubic symphysis. Pubic symphysis is an example of which type of joint? Anyone? Pubic symphysis is an example of which type of joint? Anyone wants to give the answer? Pubic symphysis is an example of symphysis. Secondary cartilaginous joint. Secondary cartilaginous joint. Okay. Where, yeah, absolutely right, RN. It's inserting into the costal cartilage 5, 6, and 7, and also into the xiphoid process. So we can clearly appreciate in the diagram that is, it is inserting into the xiphoid process and in the cartilages of 5th, 6th, and 7th costal cartilages. So we have got A as the correct answer. Let's move on to the next MCQ. Flexor of, absolutely right, RN, absolutely right, dear. So flexor of lumbar spine are all except. Flexors of lumbar spine are all except. Absolutely right. Okay. So flexors of lumbar spine are all except, whether it is erector spinae, external oblique muscle, internal oblique, rectus abdominis, and pars major muscle. According to you, which is the correct answer? So which among the following is not the flexor, but just the opposite of it, you can say. So mark your correct answer. Your time starts now. Okay, many of the students has given the right answer, and the correct answer is erector spiny muscle. Erector spiny muscle. A is absolutely correct answer. Flexure of lumbar spine is question number 3. Erector spiny muscle is not a flexor. Actually, it is having the antagonist action on the lumbar spine. Rest all, the anterior abdominal wall muscle, external oblique muscle, the internal oblique, the rectus abdominis, and the pars major muscle, all is causing the flexion of lumbar spine. My dear aspirants, I would like to give you the detail about the erector spiny group of muscle. Erector spiny, actually, this is a muscle of the back. Actually, it is consist of many group of, anyone wants to give them name? Which all muscles are included in the list of erector spiny muscle? The name are iliocostalis, longissimus muscle, spinalis muscle. So these are all the muscles of group of erector spiny muscle, muscles of the back. Together they are causing extension of the vertebral column. So please note down this point. This is important for you. The action is just opposite the flexor of the lumbar vertebrae and spine. It is causing the vertebral column extension. Okay. So origin from the spinous process of T9 to 11 thoracic vertebra, median slope of all the dorsal segment of iliac crest, inserting into the thoracic vertebra, cervical vertebra. What was importantly mentioned in this MCQ was about the action, and these group of muscle is having the action just opposite to that of anterior abdominal wall muscle, that is rectus abdominis, and external oblique, internal oblique, and all these muscles. So we have got the correct answer, A as the correct answer. Let's move on to the next MCQ, that is MCQ number 4. Corona mortis is, so what do you understand by the word corona mortis? Whether it is a vascular anastomosis, whether it is a post-mortem hurt and coronary artery examination, it's another term which is used for rigor mortis, or none of the above. So we have got 4 options and you have to give me the correct answer. Question number 4, mark the correct answer. Okay, few students has given the right answer. Actually, it's a vascular anastomosis. So we have got A as the correct answer. Corona mortis is a vascular anastomosis. All other options are not correct. So let me, yes, absolutely right, Praveen. Actually, when we are talking about corona mortis, actually the word corona mortis means the crown of death, and its common vascular variant. It is actually formed by an anastomosis which is done between external iliac artery and the deep inferior epigastric artery. So what is the anastomosis occurring between the branch of external iliac artery or the deep inferior epigastric artery with that of the obturator artery? So yes, Praveen, obturator artery and external iliac artery के branch के बीच में ये anastomosis होता है. And it is reported to present in the patient of, it is present in third of the patient on the routine CT examination, and actually it's a variant which should be kept in mind while operating in this pelvic region, because accidentally bleeding can occur by the surgeons if they perforate this anastomosis. Okay, so this is the correct answer, that it's a vascular anastomosis. Yes, let's move on to question number 5th. Okay, so you can see here obturator artery is here. Here is the inferior epigastric artery, and these are joined here by an anastomotic network that is called as corona mortis artery. Let's move on to the next. Question number 5th. Which of the following arteries is a direct branch of gastroduodenal artery? So among the option provided, according to you, which is a direct anastomosis, a direct branch of gastroduodenal artery? Whether it is right gastric artery, whether it is left gastric artery, whether it is inferior pancreatic or duodenal artery, or right gastroepiploic artery. So we have got 4 options, and you have to provide me the right answer. So your time begins now. Question number 5th, mark the correct answer. Okay, so yes. So the correct answer is right gastroepiploic artery. The correct answer is right gastroepiploic artery. Okay, right gastroepiploic artery is a direct branch from gastroduodenal artery. Gastroduodenal artery itself is a branch from common hepatic artery. So I would like to show you a diagram where you can appreciate this. So let me show you. Can you see there? So here you can see this is the gastroduodenal artery which I have marked here, and you can see here in this diagram gastroduodenal artery is arising from the branch of the celiac trunk, that is the common hepatic artery. So we have got yes, absolutely right, Praveen. So this is common hepatic artery, which is again giving gastroduodenal artery, and gastroduodenal artery is dividing directly. It's giving 2 important branches. One is superior pancreatic duodenal artery, another is right gastroomental artery. Actually, other name of right gastroomental artery is right gastroepiploic artery. Left gastroepiploic artery is a branch of which artery? Anyone? Left gastroepiploic. So right gastroepiploic artery is a direct branch of the gastroduodenal artery. Can anybody tell me left gastroepiploic artery is a branch of splenic artery? Yes, left gastroepiploic artery is a branch of splenic artery. Absolutely right. Absolutely right. Dr. Gaurav, Abhi, Steffi, Praveen. Yeah. So yes, this is a branch from the splenic arteries. So see here also I want to show you this is the common hepatic artery. Common hepatic artery. Here, these are the right gastric artery, which is branch arising from either it can be a branch from proper hepatic artery or that of common hepatic artery. Both is right. So done. Let's move on to question number 6. All the best. Let's move on to the question number 6. All of the following statement about splenic artery is true except. So which statement according to you is a wrong statement about splenic artery? Question number 6. Has a tortuous course, is a branch of celiac trunk, has branches that anastomose freely within the spleen, supplies greater curvature of the stomach. So we have got 4 options and you have to give me the correct answer. Question number 6. All of the following statement about splenic artery is true except. Okay. So yes. So actually it has a branches that anastomose freely with the splenic artery. Is it correct? Absolutely wrong statement. Can anybody tell me which type of artery is splenic artery? Splenic artery is which type of artery? General anatomy ka question hai. Yes, absolutely right, Abhi. It's an example of end artery. It's an example of anatomical end artery. So it is not anastomosing. So that C option is absolutely wrong about the splenic artery. Has a tortuous course is absolutely right. Yes, we have seen that at the upper border of the pancreas, it is running, it is having a tortuous course. It's a direct branch from celiac trunk. Yes, absolutely right. It's a direct branch of celiac trunk, and it is also the largest branch of celiac trunk. Please note down. Splenic artery is not only the direct branch, but it is also the largest branch of celiac trunk. Okay, supplies greater curvature of the stomach. Yes, splenic artery is short gastric artery. The branch of splenic artery, which is called as short gastric artery, that is supplying the fundus part or the greater curvature closed part of the stomach. As a branches which anastomose freely with the spleen. So C option is wrong. All other options are perfectly correct. Let me show you the correct details. Splenic artery is also called as lineal artery. It's a blood vessel that is supplying oxygenated blood to the spleen. It's a direct branch from celiac trunk, and it is passing superior to pancreas. It is having a tortuous part towards the spleen. So all these points are perfectly correct. Let me show you a diagram for it. Can you see here? This is the pancreas, and at the superior border of the pancreas, what you can appreciate, this is the splenic artery. So splenic artery is having a tortuous course which is running on the superior aspect, superior border of pancreas, as you can see here, and it's an example of end artery. So we have C as absolutely wrong statement about splenic artery. Let's move on to question number 7. All the best. So those who have joined late also, nothing to worry. So we have 2 sessions. I will complete the 20 MCQs, and then again 7:30 se hum anatomy quiz karenge related to most important FMG targeting 2021 examination. Which vein directly drains into inferior vena cava? Which vein is directly draining into inferior vena cava? Whether it is superior mesenteric vein, inferior mesenteric vein, hepatic vein, and splenic vein. Question number 7. We have got 4 options, and you have to give the right answer. Directly draining. Your time starts now. So, okay, 38% students has given the right answer. Actually, the correct answer is hepatic vein. When you will see this hepatic vein is a tributary of inferior vena cava, and if you will see, it is directly draining into the lumen of inferior vena cava. Let me show a diagram for it. So see here, left hepatic vein, right hepatic vein, and middle hepatic vein. So we can see clearly it is draining inside the lumen of the inferior vena cava. This is the lumen, and you can see the tributaries of the hepatic vein, which is 3 as shown in the diagram. Middle hepatic, right and the left, is directly forming a tributary for inferior vena cava and draining into the lumen. Okay, here you can see we have also got hepatic artery, the choledochal duct, and the portal vein. These are the structures which is included in the lesser omentum free margin. These are the structures lying in the porta hepatic region at the lesser omentum free margin. So absolutely right. Which vein directly drains into inferior vena cava? Here the correct answer is C. Hepatic vein is the correct answer. Let's move on to question number 8. All the best. All the best. Subdiaphragmatic right posterior intraperitoneal space. What is the other term which is used for subdiaphragmatic right posterior intraperitoneal space? Whether it is hepatorenal pouch, whether it is superior part of the supracholic compartment, lesser sac, or Morrison's pouch. According to you, which is the best possible answer for question number 8? So yes, 33% students, Morrison's pouch. Actually, you must be getting confused from option C and B because both are appearing to be similar. The hepatorenal pouch of Morrison is the correct answer. Correct word जो use होना चाहिए option में same name. No ma'am, same name hai. Oh yes, I know this is a confusing one, but this has been asked in the previous year of NEET PG, and I want to discuss. If the both of the option is given, you have to go for Morrison's pouch. The correct name is hepatorenal pouch of Morris. So yes, Stuffy, you are absolutely right. that this is a confusing one because both B and C appearing to be the correct answer. But if both options are there, you have to go for Morrison's pouch because the hepatorenal pouch of Morrison is the correct answer. So in this way, we will choose B as the correct answer. Now, Morrison's pouch. If we talk about Morrison's pouch, it's a space which is lying between the liver and the right kidney. Now, the other name of Morrison's pouch is hepatorenal recesses. So here hepatorenal pouch word used tha. Agar recesses use hota, so we could have gone hepatorenal pouch of Morrison is the correct word, or hepatorenal recesses hota, zyada correct hota. Other is right subhepatic space, right subhepatic space. So these are the names which is given to hepatorenal pouch of Morrison. It's a potential space that opens up when the fluid and the blood enters in this area. Actually, in the supine state, when the person is lying supine, this is the most dependent area of the abdominal cavity where the fluid or any kind of blood or some accumulate. So it's the most dependent part of the abdominal cavity. So when these are present, there is no space between the liver and that of the right kidney. Generally, ye wala jo space hota hai, it is evident when any kind of fluid accumulation occurs. So that is the time when it becomes more evident. So here, this is hepatorenal pouch of Morrison in between the liver and in between the right kidney. So this is exactly the location of hepatorenal pouch of Morrison. Question number 9. On contrast radiography, which of the following is the false statement? Ileum is featureless, colon has got hostrations, jejunum is free, the distal part of duodenum has got cap. So we have got 4 options and you have to mark the correct answer. So your time starts now. Question number 9. Okay, so distal part of the duodenum is having a cap. Is it right? It's absolutely wrong. So duodenal cap is present in which part of duodenum? It's present in the proximal part. We have seen that the features of proximal part is very unique to the duodenum other than the rest of the duodenum, and it is when you will see as imaging technique, radiological imaging technique and all, it will appear as a cap. It is the part which is intraperitoneal, and it's shown as a duodenal cap whenever the radiography is done, contrast radiography or plane. So that is the reason, and it's not the distal part. It's the initial 2 centimeters, 2.5 or initial 1 to 2.5 centimeter, 1 inch centimeters of the duodenum, which is called as duodenal cap. All the point is absolutely right, and let me show you a diagram for appreciating this point. Actually, ileum is featureless on the radiography, contrast radiography. Actually, ileum is having an important feature, that is the Pierce patches. It is having Pierce patches. That is an important feature, but it can't be so evident when the contrast radiography. It's a histological features. Colon has got hostration, and when radiography is done, we can clearly appreciate the hostration. Jejunum is feathery. That is also correct because it is having the valve of Kerckering. Okay, so see here, Pilica circularis, which is also called as valve of Kerckering. This is very important features of jejunum. So this is quite evident when the contrast radiography is done. So this is Pilica circularis, which you can see here. So this feature of jejunum is quite evident when the contrast radiography is done. So this is the specimen of jejunum, where you can see, this is a specimen of the jejunum, where you can clearly see the circular mucosal fold. Can you see here? These are circular mucosal fold, which is called as Pilica circularis. So this is quite evident in the contrast radiography of jejunum. Now, this is another diagram. This is the circular folds, circular mucosal folds. And this is quite evident in case of jejunum. Now, here I want to show you the duodenum. And in the case of duodenum, what you can see, this is the initial part or segment of the duodenum. This is the initial segment of the duodenum, as you can see here. And in the initial segment of duodenum is called as duodenal cap, as you can see, not the distal part. So this is the wrong option which was provided. Let's move on to the next MCQ, that is MCQ number. Okay, before that, function. The circular fold which is seen in the jejunum or the intestine is slow down the passage of digested food. So what happens? This circular mucosal fold is slowing down the digestion, and so enough time is there for the nutrient absorption. Okay, they are covered by finger-like projections villi, which is increasing the absorption. Each villi is having microvillus. So actually villus is increasing the absorption, and the microvilli is further increasing the absorption of small intestine. So this is very important for the absorption of fats, nutrients from the chyme. So we have got the wrong statement here is the D option, which is wrong. Distal not, it's the proximal part. Let's move on to the next, that is question number 10. Artery of ductus deferens arises from which of the following? Aorta, inferior epigastric, inferior vesical, pudendal, or common iliac artery. So we have got 5 options and you have to give me the correct answer. Question number 10. Artery 2 of ductus deferens arises from which of the following source of artery? 5 options are there. You have to pick the one. So yes, 44% students has given the right answer. Inferior vesical artery. So yes, absolutely right. Artery of ductus deferens is also called as artery to vas deferens. And this is a branch from inferior vesical artery. Inferior vesical artery is a branch of which artery? Anyone? Inferior vesical artery is a branch of which artery? Inferior vesical artery is a branch of which artery? Anyone? Internal iliac artery, anterior division. Absolutely right. Yes, anterior division of internal iliac artery. Anterior division of internal iliac artery. Absolutely, all of you. Now see here. So artery to ductus deferens is arising from inferior vesical artery. This is the anterior division of internal iliac artery, which is giving the branch as the superior inferior vesicular. Can you see here? This is the inferior vesical artery, and from this source, the other artery which is arising is the artery to ductus deferens of vas deferens. So we have got this as the correct answer. C as the correct answer. Now moving on to question number 11. Head of pancreas rests posteriorly on which of the following structures? Question number 11. Left renal vein, superior vena cava, splenic artery, duodenum, or superior mesenteric artery? Head. Please note down. Head of the pancreas is resting on which of the following structures? Your time begins now. 5 options are there and you have to mark the correct answer. So yes, we have got 38% of the students has given the right answer. Great going. Praveen has solved many of the MCQs right. Good one. So yes, the correct answer is left renal vein. Left renal vein. So let me show you a diagram for it where you can appreciate this relation. So actually when we are talking about the head of pancreas, it rests posteriorly. What are the structures on the posterior aspect? This is the head of the pancreas. On the posterior aspect of this head, the structures lying is the inferior vena cava, as you can see in the diagram, the renal artery. Okay, so here will be the branch from aorta, renal artery, and also the right and the left renal vein. So actually the tributaries of the inferior vena cava, so both, please note down, inferior vena cava. So what are the structures which is lying in the posterior relation of head of pancreas? The relations. So this diagram is showing the posterior relations of the pancreas. The structures resting are inferior vena cava, both right and the left renal vein and also the renal artery, right renal artery. So please note down this. This is very important for MCQ, knowing the relations of posterior aspect of head of pancreas. Everyone. Let's move on to the next. Appendicular artery is a branch of which of the following artery? Inferior mesenteric artery, inferior epigastric artery, ileocolic, testicular or renal artery. 5 options are there. Mark the correct answer. Appendicular artery is a branch of which of the following artery? Question number 12. Mark the correct answer. Many of the students has marked 67%, so great one. Praveen is leading, followed by Stuffy and Abhi and Manish Kumar, great. The correct answer is ileocolic artery. Yes, the source of arterial supply to that of the appendix is appendicular artery, and itself it's a branch of ileocolic artery. Okay, ileocolic artery, absolutely right. So my dear aspirants, please see this appendix supplied by appendicular artery. You can see here ileocolic artery, which is branched from superior mesenteric artery, which is again giving ileal branches, and it is also giving the appendicular artery. So yes, all of you are absolutely right. Absolutely right. Let's move on to the next MCQ, that is MCQ number 13. Which of the following structure is containing both the skeleton muscle and the smooth muscle? The options are whether it is stomach, whether it is jejunum, whether it is cecum, whether it is esophagus, whether it is rectum. 5 options are there, and you have to mark the correct answer. Question number 13, all the best. All important MCQs. I want to revise all important anatomy MCQs before your examination. So we have got for FMG examination, we have got approximately, it's on 12th December, so less time is there. So approximately 1.5 months में सारा important topics and MCQs I want to revise related to anatomy subject. Yeah, great one. So yes, the correct answer is esophagus. Many of the students has given the right answer, and those students who have joined late will solve the 20 MCQs. I will give you a break of half an hour. Then from 7:30 to 8:30, one more session of anatomy MCQs. Important anatomy MCQs targeting FMG examination. So you will solve this. Now see here, esophagus has got internal circular and external longitudinal layer of the muscle. Inner circular, outer longitudinal. But in case of esophagus, the whole esophagus is divided into 3 segments: upper, middle, and the lower segment. In the superior part or in the upper segment, external layer, it actually muscle layer is mainly consist of skeleton muscle. If we talk about the lowermost part or the inferior part, it is consist of smooth muscle. If I talk about the middle part, a middle 1/3, it is composed of both type of smooth and skeletal muscle. So we have to pick which is the correct answer, D, which most of the students has already given the correct answer. Iliopubic tract. Iliopubic tract is thickened inferior margin of which of the following structure? Is the source inguinal ligament? Is the source transversalis fascia? Is the source conjoint tendon? Is the source falciform ligament or round ligament? So we have got 5 options, and you have to give me perfectly correct answer. Question number 14, mark the correct answer. %58% students has given the right answer. Okay. So the correct answer is transversalis fascia. B is correct answer. Iliopubic tract is thickened inferior aspect of the transversalis fascia. So yes, inguinal ligament is formed from external oblique muscle, conjoint tendon both from internal oblique transverse abdominis. Falciform ligament is again an extension which seen in the lower aspect of the close to greater spinous vein. Round ligament of uterus is there. So none of this structure except the transversalis fascia is the correct answer. So see here, iliopubic tract is thickened inferior aspect of transversalis fascia, and if you will see this iliopubic tract is a fibrous band. Okay, Can you see here the iliopubic tract? And this iliopubic tract is in the form of a band, and the origin of this band is from transversalis fascia. The origin of this band and formation of this band is from transversalis fascia. It's demarcate the inferior edge of deep inguinal ring, lying very close to deep inguinal ring. Got it, everyone? Let's move on to the next, that is question number 15. So we have got B as the correct answer. Transversalis fascia is the correct answer. Absolutely right. Okay. Which of the following structure is forming a connecting link between lesser curvature of the stomach and the proximal aspect of the duodenum to that of the liver? Whether it is greater omentum, whether it is peritoneal ligament, whether it is mesentery, whether it is lesser omentum, or whether it is peritoneal fold. So we have got 5 options and you have to select the right answer. Five options are there. Mark the correct answer. Okay, so yes, 77% students has given the right answer. Praveen is leading, followed by Stuffy, Manish Kumar, Abhi, Dr. Gaurav. Okay, the answer is lesser omentum. So actually lesser omentum again has got 2 parts. One is hepatogastric part, another is hepatoduodenal part. Lesser omentum again has got 2 parts. Okay, yes, absolutely right, absolutely right. Okay, which is done in relation to this. Yes, the yes, Praveen, yeah, absolutely right. So it is having the hepatogastric and the hepatoduodenal part, and in the free margin we have got 3 important structures lying there. So anyone remembers the 3 important structures? Portal vein, hepatic artery, bile duct, and this is forming a link. So you can see here the both hepatogastric and hepatoduodenal part, which is forming a connection between the proximal part of duodenum. So this is whole, this is the initial part of duodenum, and this is the liver. Okay, this is the liver. So it's connecting the okay, this is the liver, this is connecting the lesser curvature of the stomach. Sorry, this is the initial part of duodenum, and this is the lesser curvature of the stomach, which is connected to the hepatic region, portal region, or the portal triad region by this ligament, lesser omentum. 2 parts. All statement considering esophagus is correct except. So all of you just see the 5 options about the esophagus. It extends from the pharynx to the stomach. It is crossed by arch of aorta. It is crossed by right main bronchus. It passes through esophageal hiatus. It's normally having the 4 constriction. So according to you, which is the wrong statement about esophagus? Your time starts now. Question number 16. %67% students has given the right answer. The correct answer is it is crossed by right main bronchus. It is absolutely wrong. Can anybody tell me which structure is crossing? Whether it is right main bronchus or left? Absolutely right. It's the left main bronchus. It's not the right. It's the left main bronchus. So here C option is absolutely wrong. All other options are perfectly correct. It extends from the pharynx to the stomach. It is crossed by arch of aorta, and it passes through the esophageal hiatus or opening of the diaphragm, and it has got perfectly 4 constriction. I would like to show you that diagram. So see here, esophagus is a muscular tube approximately 25 centimeters in the length, extending from pharynx to the stomach, and importantly it is having 4 constriction, and it is having the initial constriction at the level of pharyngo-esophageal junction. सबसे ऊपर में pharyngo-esophageal junction में एक constriction होता है, Then we have also got arch of aorta and left main bronchus, and also the fourth constriction is esophageal opening of diaphragm. Esophageal opening of diaphragm. So these are together four constriction for the esophagus. See here. So I would like to show you this constriction. The first one is pharyngoesophageal junction. The second one, as you can see, is the arch of aorta. The third one is the left principal bronchus, and the fourth one is esophageal opening of the diaphragm close to right crux of the diaphragm and approximate distance. So for your MCQs and for the previous session of FMG examination, what is important is that you should also know the approximate distance of these constriction from the incisor teeth of so that is what it is mentioned here. It is approximately 6 inches from the incisor teeth. The pharyngeal first constriction, then 9 inches, then 11 inches, and that of the esophageal opening is corresponding level of 15 inches from the incisor teeth. So all of you, please note down the level of constriction also. This has also been asked in the previous year. Let's move on to the next, that is question number 17. All the best. Done? Okay, let's move on to next. Okay. Trapezius is attached to which of the following region of clavicle? According to you, which is the correct answer? Trapezius muscle is attached to which of the following part of the clavicle bone? Whether it is trapezoid line, whether it is subclavian groove, whether it is conoid tubercle, or it is the lateral 1/3 of the clavicle. Question number 17, mark the correct answer. Your time begins now. Okay, sharing the leaderboard. Praveen is leading, followed by Stuffy, Manish Kumar, Abhi, Dr. Gaurav. Okay, so if we talk about the correct answer is lateral 1/3 of the clavicle. Lateral aspect of the clavicle. So what attaches to the medial aspect? Can anybody tell me medial aspect? Lateral पे trapezius है, तो medially कौन सा muscle attach है? Which muscle is attached on the medial aspect? Medial aspect, pectoralis muscle, also the subclavius to groove, pectoralis. Who have given the pectoralis answer? Yes, yes. Okay. Superior medial पे sternocleidomastoid also होता है. Yes. तो superior, yes, absolutely right. Sternocleidomastoid muscle medially होगा. Subclavius muscle तो subclavian groove में होगा. तो it is in the inferior part. Medially is sternocleidomastoid and pectoralis major muscle. Absolutely right, all of you. And if you will see this diagram, you can clearly appreciate this trapezius muscle is attached onto the lateral part. What is this? Is the clavicle का कौन सा part है? This is the lateral part of the clavicle which is giving attachment to trapezius muscle. Absolutely right. Now, my dear students, please revise the origin and insertion of trapezius muscle. Origin is occurring from the base of the occiput bone spinous process. This is the upper fibers, middle fibers, and the lower fibers of trapezius muscle. And you can see it is inserting onto the spine of scapula, acromial process, and the clavicle. So the insertion point is it is inserting the upper, middle, and the lower fiber together. They form a one bulk of the muscle, and together they get inserted into the spine of scapula, acromial process, and that of the clavicle. Yeah, yes, Stuffy, I'm coming to that. Trapezoid line and this is giving attachment to the ligament. Okay, so I am coming to that. Don't worry. So now I want to show you. So yes, Stuffy, please see the diagram. I want to show you the inferior aspect of the clavicle. And when you see the clavicle line, okay, line below. Yeah, absolutely right, Dr. Gaurav. So you can see this is the trapezoid line and this is the conoid tubercle. Can you see? So in the inferior aspect, you can see also in the inferior aspect, you can see subclavian groove, which is giving attachment to the subclavius muscle. The trapezoid line and the conoid tubercle is giving attachment to the ligament, coracoclavicular ligament. It is giving attachment to conoid and trapezoid ligament, conoid and trapezoid part of the coracoclavicular ligament. So see, now this is the clavicle bone, and on the inferior aspect of the clavicle bone, the green color muscle is the subclavius muscle. So this is exactly the subclavius muscle which is lying on the inferior aspect or is located in the subclavian groove. And here the conoid and trapezoid part, as seen in the inferior surface of the clavicle, is giving attachment to conoid and the trapezoid part of the ligament, coracoclavicular ligament. It is okay. Is it okay, Stuffy? Yeah. So see here, now I want to show you, here you can appreciate, now my students, you can see here, this is the clavicle bone, and in the inferior aspect, two ligaments is connecting to that of the coracoid process of the scapula. And here you can see, this is the coracoid process of the scapula, and this is the part of coracoclavicular ligament. So what I have shown you the bony prominence, I have shown you the clavicle diagram, जहाँ पे आप clearly trapezoid line or conoid tubercle appreciate कर सकते हैं. From that part, the ligament which is attached is the coracoclavicular ligament from the clavicle to the coracoid process of the scapula. This is scapula. Is it okay, everyone? Everyone clear? Give me a thumbs up if it is cleared. Absolutely right. So, okay, can we move on to the next MCQ, question number 18? After completing 20 MCQs, again a break will be given to you for half an hour. 7:30 से next session, 1 hour का session है, means 50 minutes or 55 minutes, and then we will solve another 20 MCQs. All the best, everyone. All the best. So don't worry. Now I will continue this free classes ka session on U-session and on the special classes. I will share the link in the group. All of you do join. So we will cover up the entire anatomy, which is not a true in respect to ulna and radius. Which of the following statement is not correct in respect to ulna and radius? Brachialis muscle attached to the tuberosity of ulna. Ulnar styloid process is larger than the radial styloid process and extend further distally. The head of the ulna lies distally, whereas the head of radius articulate with the humerus bone. Ulna is medial to the radius in the anatomical position. Septa of these bones are firmly bounded together by interosseous membrane. Question number 18, 5 options are there. You have to tell me which is not true in respect to ulna and radius. Which of the following is not a true statement in respect to ulna and radius? Your time starts now. Please read the option nicely. All of you, please read the option nicely and mark the correct answer. Question number 18. So yes, 62% students has marked it correct. Praveen is performing very nice. Many students must have joined late also. That may be the reason. Very nice. So the correct answer for this is ulnar styloid process is larger than the radial styloid process and is distally. Actually, this is absolutely wrong. You will see the diagram. You can appreciate radial styloid process is passing distally, not the ulnar one. All other statement is absolutely correct. I would like to show you a diagram which will appreciate all these correct statements. So interosseous membrane connecting, absolutely right, radius and ulnar bone. Ulnar bone, yes, we already know that ulnar bone is a medial bone in when we keep our forearm in the anatomical position. Head of ulna lies distally. Okay, yes, head of ulna and the head of radius is distally and proximally. So actually, outer end of the radius proximally is the head and lower end of the ulna is head. Absolutely right. Brachialis is attached to tuberosity of ulna is absolutely correct. Let me show a diagram for it. Okay. So my dear aspirants, can you appreciate here that the interosseous membrane, the green color highlightation which I am doing, this is the interosseous membrane and this is connecting the two bones here. Yeah. Okay. Now also you can see here the radial tuberosity and the head of radius is superiorly, but if you will see head of ulna bone ko agar aap appreciate karte ho, to ulna bone mein head is, you can see here, this is the head and this is lying distally. See here. So what you can appreciate, the head of ulna is lying distally. The head of radius is lying proximally. Okay, and the two bones are connected by interosseous membrane. Now, also I want to appreciate here, I also want to show you that this is the head of the radius and it is articulating with the capitulum of the humerus. Actually, elbow joint. What you can see here, my dear aspirants, you can see the view of the elbow joint where the articulation of the three bones has been shown. Okay, so you can see here the coronoid process, the trochlear notch, the trochlea of the humerus, the capitulum articulating with that of the head of the radius. So all these points, bony landmarks which has been shown here, is showing you the articular part of elbow joint. Now, so here also I want to show very nicely that brachialis muscle. What is the insertion point? The insertion point which has been highlighted in this diagram is this brachialis muscle, which is arising from the distal anterior aspect of humerus, which is a big bulky muscle, and it is inserting into the coronoid process of ulnar tuberosity. Not only on the coronoid process, but also into the ulnar tuberosity of the ulnar bone. So this statement is also perfectly right. Now, my dear students, can you appreciate this is the radial styloid process and this is the ulnar styloid process. So which is lying at the lower end? Clearly, you can see radial styloid process is more distally. Yes, absolutely right. It is lying at the lower end and this is lying slightly proximally. And also radial styloid process is larger in comparison to ulnar styloid process. So this was absolutely wrong statement. So we have to pick the one. So I will come to the next MCQ. We have to pick one. So absolutely wrong statement is option B. Yeah. So let's move on to question number 19 and 22 more MCQs are there to solve. Again, after completion of the session, half an hour gap, and then 7:30, all of you do join for the next session, and together we will complete anatomy MCQs together, target the examination. Now, question number 19. Retromammary space is located between which of the following structure? Whether it is skin and areola, whether it is pectoralis major and the minor muscle, the breast and the deep pectoral fascia, the suspensory ligament and the skin, the lactiferous sinus and the nipple. So 5 options are there and you have to mark the correct answer. Question number 19, mark the correct answer. Question number 19. 5 options are there. Okay, mark the correct answer. Question number 19. Your time starts now. Okay, let me see the leaderboard. Okay, great performance by everyone. Yeah. So the correct answer is breast and the deep pectoral fascia. Retromammary space. So this space is very important for implanting the breast implant. In cases of cancers, breast cancer mein kya hota hai? We have to go for mastectomy operation and we remove the breast. But cosmetically, it is not... so many of the females and ladies, they want to reconstruct the breast, and for that we put on the implant, breast implant, exactly at the space which is lying between the breast and the deep pectoral fascia. This space is called as retromammary space, which is done in cases of radical mastectomy, and for cosmetically it doesn't look nice, so this space is utilized for putting the implant, breast implant. Let me show you this space. So exactly the space is this. I'm talking about this space, this green color area which I'm highlighting. This is the space, and this space is exactly located between the pectoralis fascia. Can you see here? This line is the pectoralis fascia and this whole area is the breast. So what is the area? So all of you can clearly appreciate the space here. This is the retromammary space. Can you see here? This is the retromammary space, and this space is exactly located between the breast and that of pectoralis fascia. So is it clear, everyone? Anuja, Soumya, those who have joined, that it is exactly located breast and deep pectoral fascia. So all of the students, those who are joining late, nothing to worry. I have 2 sessions in consecutive manner. So we will complete this session. Those who have missed out, now also can revise and see the session. And again, 7:30 say one more session is there. So link will be provided in the group. Do join. So let's move on to the next MCQ. All the best to everyone. All the best for this next MCQ. Okay. So diaphragm. Diaphragm is not derived from which of the following? Whether it is septum transversum, pleuroperitoneal membrane, muscular component from the lateral and the dorsal body wall, mesentery of the esophagus, anterior thoracic fascia. 5 options are there and you have to mark the correct answer. Diaphragm is not derived from which of the following? Question number 20th, mark the correct answer. Which of the following component is not giving rise to the embryological development of diaphragm? Your time begins now. Mark the correct answer. Okay, yeah. Okay, let me share the leaderboard. Okay, so yes, Praveen has scored a very nice score. Stuffy also has performed. Manish Kumar, Avi. So many of the students must have joined late. Actually, the correct answer is endothoracic fascia. Endothoracic fascia is not giving rise to any of the component of the diaphragm. Rest all the components which is mentioned here: transversum, pleuroperitoneal membrane, muscular component from the lateral and the dorsal body wall, and the mesentery of esophagus. All component is the embryological source of formation of the diaphragm. All these components is giving rise to the development of diaphragm, but not the E. So we have got E as the correct answer. Let me show a diagram for it so that it will be more clear to you. So let us come to the diagram. My dear aspirants, see here. This is the pleuroperitoneal fold. This is the pleuroperitoneal fold. Pericardial peritoneal canal has been shown. Septum transversum. So pleuroperitoneal fold, 1. Septum transversum forming central tendon. Dorsal mesentery of the esophagus here. Also the growth from the body wall. Okay, so we have got growth from the body wall. So 1, 2, 3, and 4. What I have mentioned here, that pleuroperitoneal membrane, the dorsal mesentery of the esophagus, the muscular ingrowth of the body wall, and the septum transversum. These are the 4 sources which is giving rise to the whole component of the diaphragm, and diaphragm is a muscular component which is dividing the thoracic and abdominal cavity. What is very important for the diaphragm is the openings of the diaphragm, all the major and the minor opening, and also the source of development of diaphragm, along with the hernias: congenital diaphragmatic hernia, Blugdolach hernia, and Morgagni hernia location. So many times that MCQs has also been included. So that is important that you should go through this and revise this. So many of the students has joined late. So nothing to worry. What I want to give you the information that 7:30 p.m. now itself. So after a break of just 30 minutes, you all can join me 7:30 p.m. live. The same thing, you have to download the Unacademy app. Who are using the platform for the first time, they should use the code ANAT10 for unlocking my session. I am sharing the link of my class in the Telegram group. Do join from the 7:30 p.m. All the best. Keep studying. And on the tomorrow also evening, I am taking one of the session. So in continuation, the session will be taken. All the anatomy MCQs, we will revise entire anatomy via the source of MCQs. All the best. Keep studying. Thank you so much. So let's meet after half an hour. Is it okay? After half an hour, after 28 minutes, I think 28 minutes is more. So we will just again get connected. All the best. Keep studying. Thank you so much. Thank you. Thank you, everyone. Thank you.